This is ranked top by almost 1/4 of respondents this year. And compare that to just 2 years ago, when it wasn't even in the top 10 of 2-year risks. This just shows how, unfortunately, the world has changed over the last couple of years. Over many, many years, environmental risks have topped 10-year risk outlook. But this year, we have 2 that have come into the top 10 in the short year outlook as well. Extreme weather events and pollution. And so I think this is perhaps a sign that the message is getting through, that this is, this has become a short-term crisis.
Men are actually the norm when it comes to clinical research. And this has led to fewer effective treatments, more side effects for women, and even less treatment available for women. And I can give you the example of endometriosis, where it actually affects 1 in 10 women globally. It takes approximately 10 years to receive a proper diagnosis, and still we don't have any cure available.
Equity is a fundamental principle of human rights between women and men, and if we don't have health equity, we live less healthy lives and have less well-being. than men.
I mean, there's all sorts of economic reasons why you unilaterally might want to impose tariffs, perhaps to expand your manufacturing sector, perhaps to generate additional jobs, perhaps to protect domestic industries, and so on. The problem is just that other countries have the same incentive also. So if I try to expand my manufacturing sector, for example, at your expense, and you try to expand yours at my expense, then at the end of the day, none of us has achieved their objective, and all we've done is increase prices for our consumers and also for our firms. One thing that I always say, particularly when you think about international trade, is not just about trade costs, it's not just about tariffs, but it's also about the expectation of what these trade costs and tariffs are going to be. Because if you as an investor now can't be sure what tariffs are going to be next year, what they're going to be in 5 years, that already today, even though nothing might have happened, is already going to affect your choices. One figure that most people don't know is that bilateral trade between China and the United States actually only accounts for less than 3% of world trade. So it generates 80% of the news, but only 3% of world trade, if you will. I think it's safe to predict that trade tensions between these two countries are going to persist. I think the key question is this going to spread to other countries, or is this going to be contained to that bilateral relationship? I think all of us would agree that the division of labor is an absolutely fundamental pillar of our prosperity. If I had to make all of my clothes, all of my food, all of my housing, all of my shelter, and so on by myself personally, clearly this would be a disaster. So what do? I specialize in something, you specialize in something, and we exchange. I think it stands to reason that this is the absolute fundamental pillar of our prosperity. Now, international trade is just an extension of this very basic idea across international borders. And why should the power of the division of labor stop just because there's an international border in the way? So I'm really hoping that policymakers also supported, influenced by business interests, by consumer interests, by civil society, will come to appreciate that we are all better off cooperating and we are all better off trading than moving towards some sort of tit-for-tat situation that is going to leave all of us worse off.
Nursing is the biggest health profession, now close to 29 million nurses worldwide. But at the same time as being the largest, we also have a global shortage. So we have a gap between the supply of nurses and the demand for nurses. And that gap, we believe, is not only an issue for health, the status of population health, but also directly impacts on economic growth and economic recovery as well. It's my profession, you know, and I've been there and worked clinically. And what I remember when I think back to my time working as a nurse, that a lot of the issues that I hear nurses talk to me about now, right the way around the world, are very, very similar, or indeed the same as they were many years ago. There's been estimates that up to 10% of global GDP can be impacted on by not getting care right in the first place. Short staffing creates a risk for patients. It also puts pressures on nurses themselves. Poor working conditions. We have dreadful examples still of violence against nurses and other healthcare workers right the way around the world. Always a struggle to get decent, fair pay. 90% of the world's nurses are women, and that has absolutely played into lack of issues around promotion, pay, decent working conditions as well. These notions and concepts of it's a calling, it's a vocation. For some people it may be, but it is also a job, and nurses have rights as much as everybody else. Nurses, to coin a phrase, are ordinary people doing extraordinary work, and we need and we demand the support and the protection for them. One of the things I think that we should be doing, perhaps even a little bit more aggressively, is promoting nursing as an alternative career to people who are in sectors where technology may replace a lot of the human resources that we currently have as well. We absolutely should do more to promote nursing to men, not as an answer to the inequalities that have been historical and deeply ingrained. But for me, there's an equity argument there as well.